The role I think this clinic serves in the community is actually several roles. I think first it's a good outreach to the community to let them know that IU School of Medicine has a presence here in this area, but also it has an opportunity to care for patients of this area who may not have the resources to seek health care. And it provides a great training ground too for our students who are eager to get out and provide patient care, to help the community, to serve others, and it just provides a forum for all of those things.
I love the clinic and working with the patients. You know, it's a good learning opportunity for us and it's a good resource for the community. We're able to kind of see real patients. In the first 2 years of medical school, you're really into the books and you're more into kind of more theory and deep basic sciences, whereas opposed to, you know, you kind of get these breaks in Molly Wheat to be able to see patients. And it's great for the patients because it's a completely free clinic. We don't charge for labs, we don't charge for the doctor's visit.
Helping people in the community especially appeals to me because I'm from Lafayette, so this is my community. It's the community that I grew up in. So it really helps me to feel like I'm giving back to the community that raised me.
I think my main thing is I do really like serving the community and I like getting to do things outside of my main focus of school, even though it's school related, but I like the service aspect of this. So I think that's something I want to carry on in the future, and my future career is committing my time to clinics and more of like the underserved populations, because like I said, they can go so overlooked. And if I have the expertise and the skills to provide them with care, I want to be able to do that, whether it's within my job or outside of it.
I love coming here. The medical student that I have been seeing has been the same one every time I've came, and he really cares about my health and he listens very well to what I'm saying.
Seeing patients is my favorite part of the day, being able to talk to them, especially the patients I've seen in the past, and that follow-up a couple months later, seeing their progress, seeing how they've improved, and just how grateful they are to have free medical care. Especially the patients that couldn't afford, a doctor's visit or their prescriptions, and we're able to give them free prescriptions for their medications that were too expensive in the past, and just seeing how their life is transformed by being able to access care is just really, really fun to see.
I mainly came here because I needed some blood work done. I had not met my deductible for my insurance, so I knew I was going to be paying out of pocket. So financially, it has helped me. They did a complete blood work analysis on me, free of charge. Oh, it's been awesome. I recommend anyone to come here.
I think a lot of medical students want to be a part of this to get that patient interaction. I think a lot of students are committed to giving back to the community and serving the underserved and underinsured people of Indianapolis. They are able to do that while getting also a great educational experience that is very similar to what we do in our rotations during our third and fourth year. So we're able to apply what we learn in the classroom and in our rotations and put it here together at the clinic.
The medical students are amazing. Of course, the clinic couldn't be in existence if it wasn't for them, and they do a really good job. One thing I really notice is they befriend our neighbors. We call the people that come neighbors instead of patients, and they're happy to see them when they come for a return visit, and they get involved in their lives. Some of the medical students even have paid for an Uber for someone to get home, or if it's something that can't be solved here, if they need it to go to a hospital immediately, they'll help them get there. They're just amazing the way they deal with the people who come here.
It is a real life experience for the students. For the past 15 years, what I have heard from them is that it's the best experience they have through medical school, because they can come here from first year all the way through fourth year. So they get their medical school years serving the community in a way that they can't do otherwise.